performing your ears, nose, throat, and eye exam today. Are you in any pain right now?
Nope.
Perfect. Do you wear any corrective lenses?
Nope.
Okay, great. First one we're going to do is your visual acuity test. I'm going to hold this about 14 inches away from your face. Can you cover, actually, with both of your eyes, can you read the smallest line that you can see?
LTFPH.
All right, can you cover your right eye, please, and read the smallest line that you can see?
LTFPH.
Okay, can you cover your left eye now and do the same thing?
LTFPH.
Perfect. Next, we're going to do your visual field screening. I'm going to come to your level, and then I'm going to test your peripheral vision. Whenever you see my fingers move, just say now. Okay?
Yep.
Ready?
Now. Now. Now.
Okay, can you cover up your left eye? And we're gonna test that eye first. Can you do the same thing?
Yep.
Ready?
Now. Now. Now.
And can you cover your right eye and do the same thing?
Now. Now. Now.
Perfect. Alright, now we're gonna check your eyes out. I'm gonna look at your lids really quick and your lacrimal apparatus. Okay. I'm actually gonna check it out, make sure there's no tenderness. Does that hurt at all?
Nope.
Perfect. Alright, now I'm going to look at your sclera. I'm going to help open your eyes, okay? And then I'm going to have you look all the way up, all the way down, to the left, to the right. Perfect. No scleral edema, hemorrhage, or yellowness. Okay. Now I'm going to look at your corneas and your lenses for any opacities. I'm going to actually turn the light down while we do this test. Okay, I'm going to check your other eye. Alright, that looks good. It's clear, unobstructed fundus, reflex, and I see a flash of orange. Okay, now I'm going to check to see your accommodation and if your pupils are equal and reactive to light. Very good. Alright, your pupils are equal, round, reactive to light, and they accommodate. Next, I'm going to check for your corneal light reflections. Okay, I'm going to stand in front of you and I'm going to have you look directly at my light, okay? Perfect. The light was midline in your pupil, exactly where we want it. Now I'm going to look at your extraocular movements. I'm going to have you keep your head still, follow my finger with your eyes. Very good. Gaze is symmetric, no gaze deviation, dysconjugate gaze, or nystagmus. Alrighty. Now we are going to check with my ophthalmoscope a couple extra things. Alright, so I'm going to first check for your optic disc. Ready? Actually, I'm going to check this eye out first. Very good. Sorry, I know that's really bright. Check with this eye now. disc is yellowish orange, clear distinct outline. Your physiologic cup is about half the size of your optic disc. I was able to see your veins versus your arteries. Your veins are lighter than your veins are darker than your arteries. And then I was able to see clear arteriovenous crossings. Next I'm going to check are your ears. I'm just going to change this ophthalmoscope to my otoscope. I guess I could probably turn the light back on too. First, I'm just going to check out your ears just to make sure there's no lesions, masses, or tenderness. You tell me if this hurts at all when I'm touching. Does that hurt?
No.
Okay, great. I'm going to check the other side out. Perfect. Ears look good. There's no masses, lesions, or tenderness. Now I'm going to check out your ear canals and your tympanic membranes. I'm going to first pull back your ear a little bit, up and out. I'm going to insert it before I look inside, make sure you're nice and safe. Perfect. Ear canal is clear, no excess wax. And your tympanic membrane is pearly gray. I'm going to check over here now. Insert it before I look. Perfect. Ear canal is also clear over there. Tympanic membrane is pearly gray and shiny. Exactly what we want. Okay, now we're gonna do some hearing tests. I'm gonna stand behind you and I'm gonna say a 2-syllable word. We're gonna cover each ear individually. I'll tell you which ear. Just repeat what word I say back to you, okay? Alright, can you cover up your right ear for me?
Football.
Perfect. Can you cover your other ear?
Pumpkin.
Very good. Okay, now we're going to move on to your nose. Check it out. It's symmetrical. And your nasal passageways look symmetrical. I'm going to touch your nose to see if there's any tenderness, okay? Any tenderness with that? Okay, can I have you breathe in and out? Perfect. And in and out. Very good. There's no masses, tenderness, lesions. Your airway seems patent. There's no obstructions when you're breathing in and out. Let's check your internal nose. I'm going to take my light and look inside of your nose as well. Make sure there's no obstructions or anything like that. I'm going to insert my light just past your nose hairs. Nice and clear. Did you have any discomfort with that?
Yeah.
Okay. Nice and clear. Okay. Oh yes. Now I'm just gonna feel your sinuses and see if there's any tenderness. So you just let me know if you feel any pain or tenderness as I'm palpating. Does that feel okay?
Yep.
Alright. How about now? Does that feel alright?
Yeah.
No tenderness?
Nope.
Perfect. Alrighty, now we're going to move on to your mouth and your throat. I'm going to check your lips out first. Okay, Just looking at your lips now, they're moist, intact, dry, no lesions, sores, or anything like that. I'm gonna look at your the inside of your mouth with my light and a tongue blade, okay? Ready? Open real big. Put your gums here too. Can I have you stick your tongue out? Say ah. Okay. Very good. Your oral mucosa is pink and moist. There's no lesions, cracks, or masses. Your gingiva and your teeth are nice and clean. I don't see any obvious decay, bleeding, ulceration. There's no swelling. In your gums, they're nice and pink. Your hard palate looks nice and pink and moist. There's no masses or lesions. Along with your soft palate, your uvula is midline. There's no edema. Your tonsils look good. There's no excess swelling, lesions, and they're symmetrical. And there's no exudate. Your tongue is also nice and pink, moist. There's no lesions and midline. Last thing I'm going to do is just check all of your lymph nodes, okay? I'm just going to massage them. You let me know if you feel any tenderness or pain, okay? I'm going to start with this one. This is your preauricular, right in front of the tragus. Does that feel okay?
Yep.
Now I'm going to do your postauricular, behind the ear. Does that feel alright?
Yep.
Okay. Now I'm going to do your occipital. It's at the base of the skull. Still feel okay?
Yep.
Alright, now I'm going to do your submandibular and your submental. Okie doke. And your superficial cervical and your, actually I'll start with your anterior cervical. I'm going to do these one at a time. It's right by your carotid artery. Does that feel okay?
Yep.
Okay. And then also your posterior cervical, also back here. And then can I have you pull, actually, you know, I can pull it and I'll just do them one at a time. That way we're not stretching your collar out. I'm just doing your supraclavicular. Any tenderness or pain?
No.
Okay. So I did not feel anything. I didn't even feel that your lymph nodes were swollen and they were not tender, so that's great. All right, and that concludes our exam. Do you have any questions for me?
Nope.
Perfect, thank you.
Thank you.